Welcome to day 4 of Hypertension Self-Care Education Challenge. Today we'll be discussing about the risk factor of hypertension. What are the causes of hypertension? So when blood pressure is in rise, we have to introspect and we should look into the following few things. If those are in our life, I think we should try to do something about those things. Number one is the stress. Stress is the biggest killer. And what happens in stress? Why the blood pressure? Because when you are in stress, body goes into a fight and flight mode. So during that flight and flight mode, when our body thinks I have a problem, so the innate mechanism starts playing to protect us. To protect us, the vessels start constricting and they start supplying the blood to the periphery. So in that case, the pressure in the artery, they get narrowed. So the pressure, the heart has to give more pressure to supply the blood to the whole of the body from tip to toe. So whenever you are stressed, this thing will happen. But it is a temporary phenomenon. So once the stress is over, the things becomes normal. But remember, if this stress stays in our body for a longer period of time, it will be a permanent thing and we all will be damaging our vessels and causing the raise and will create a nice pathway for our blood pressure. So stress factor has to be discussed. So how should we manage it? We'll discuss it through meditation, through different methods. Medications and meditations are the things which are needed for to keep ourselves stress-free. Now, next thing comes the food. All the things, the food which we eat are the things which are going in our body and creating either good thing to us or bad thing to us. So when our food is rich in oils and non-vegetarian food, you can say, or cholesterol is more, so the deposits in the artery, again which causes the same thing, is narrowed down and it asks our heart to create more pressure to do the same job. So here again we have to, once we know that we are hypertensive, that means we are doing something wrong, we have to take care of ourselves. We have to rethink. Third thing comes is excessive salt intake. The third thing which I always say is the excessive salt intake. Some people, they take excessive salt. Normally the salt which is available in our normal food is not much. We always say we should restrict our salt to 2300 milligram. Fine. So in the normal day-to-day activities, in day-to-day food habits, we don't take much. But once we are taking so much of fast food and we are loading our body in this salt intake, our sodium will retain the water. Once it reaches water there, it will create more volume. So our heart will try to pump it as fast as possible. So it will create a pressure. Number 4 comes physical inactivity. When we do not do physical activities, our vessels remain in a constricted mode because there is no need of supply, there is no demand of. When there is no demand, our mechanism will normally narrow it down because there is no need of more blood to the things. So inactivity is a cause of hypertension. Remember this thing. So you have to at least do some work, some physical exercise every day. So we'll talk about all those things later on. Then comes the obesity. The more we are obese, the more we are damaging our vessels. Why? Because of the free fatty acids in our free oxygen radicals in our body. So we'll be damaging our wall. So we'll ultimately constricting or narrowing our vessels, and ultimately we'll have a blood pressure. So these are alcohol and smoking. These are the things which are the risk factor, the people who take alcohol and they smoke are more prone to hypertension because of the same mechanism. Because here, by consuming these things, we create lot of oxygen-free radicals, and those radicals are dangerous to our vessels and they damage the vessels. Ultimately, we'll end up in hypertension. So today's lesson is nothing. You just jot it down. If I told all these things, are you in this all category? Are you having something in this you are doing? Then stop it. Because hypertension is a silent killer. It will never tell you when it will be causing problem to you, or it will make you suffer. So today, those people, whoever are watching this video, should try to stop this. If you can't stop it, ask for a help. At no prescription point, we are there to help you. Please take our help. Thank you very much.